Hi, and welcome to the channel where we discuss medical topics and lifestyle. In today's video, we are talking about Lyme disease. Because it's spring, it's important to discuss Lyme disease because the infection is on the rise in the spring. We're going to cover how we get it, where it comes from, signs and symptoms, treatment, and in the end, we'll cover some really useful practical tips on avoiding it. Let's get into it. I guess let's start off with a fun fact. So, why is it called Lyme disease? Because it was first reported in the USA in around 1997 in Old Lyme in Connecticut. That's why it's called Lyme disease. So, what is it and what causes it? Lyme disease is an infectious disease, and this infectious disease is caused by a spiral shaped bacteria. So, it's in the shape of a spiral, and this bacteria is called Borrelia burgdorferi. So that is what Lyme disease actually is. Now we'll move on to what actually causes Lyme disease. So Lyme disease is caused by ticks in most cases. So a tick is what causes Lyme disease. It can be other insects, but generally it's ticks. Now, ticks can vary in size. They can be as small as a poppy seed, whereas other ticks can be the size of a baked bean, so they can vary in size. And then what causes Lyme disease is when this tick bites you. So that's the whole picture, really. Now, you may have questions about whether this bite hurts or do all ticks carry Lyme disease. These are good questions. We're going to cover them in a sec. So we know the tick bites you and you get Lyme disease, but let's dive a little bit deeper into it. So how do we actually get it? So not all ticks result in Lyme disease. Not all bites result in Lyme disease. So why is that? Why is that actually the case? Well, that's because the tick isn't the father of the Lyme disease. It's not where it originates from. It's actually coming from a deer or a mouse or a hedgehog. So that's the guy we're going to blame. We're going to blame the deer or the mouse or the hedgehog, really. So the tick gets it from the deer or the mouse or the hedgehog, and then it carries it over to a human. Over here in the UK, around 10% of ticks carry Lyme disease. So it's really not even that big of a number. So 1 in 10 ticks. And where are we actually getting this from? So you may have guessed it, right? So it's woodlands. That's where the tick can be located. But it can also be in parks and things like that. So these are the areas where a human can brush past a tick in these areas, and then the Lyme disease finds a new human host. The tick then can find a nice warm spot on the skin and give you a little bite. Areas where they like to attach is the hairline, the axilla, so the armpits, or the groin areas, and most people don't even realize they've been bitten. So why is that the case? Is there pain? What's going on there? Do we scream when it bites us? Well, not really, because the tick injects a little bit of a local anesthetic, which causes some numbness, and then it gives you the bite. So you don't even feel it. And now we get into what it actually looks like. So the juicy part, what everybody wants to know, signs and symptoms. So the big one is actually called erythema migrans. So that's the big thing that's associated with Lyme disease. So this is what it looks like. It looks like a bullseye. That's how the rash can manifest itself, and it's quite characteristic of Lyme disease. This type of rash usually appears within 1 to 4 weeks, and it can last for several weeks. And then we have other generalized signs and symptoms. So we can have a temperature, we can feel hot and cold, we can have joint pains and muscle pains. There can be a shivery sensation, tiredness, and fatigue. So the general kind of signs and symptoms that you would associate with generally feeling unwell, that's what you can get. And then some people with Lyme disease develop more severe symptoms, including joint pains and swelling, nerve problems, memory problems, heart problems, and they can go on for months or years after infection, which is the difficult part. But generally, the big sign that we associate with Lyme disease is erythema migrans. So it's that bullseye characteristic, and the rash can appear up to 3 months later. So this is what all the focus is about. People should look out for. What to look out for? I mean, it's a circular or oval-shaped rash around a tick bite. These can be early symptoms of Lyme disease in some people. For the medical background people watching the video, there's new guidelines published by NICE here in the UK, where if characteristic bullseye rash is present, healthcare professionals should feel confident in diagnosing Lyme disease. So doctors are advised not to wait for potential Lyme disease blood test, which is usually how you diagnose it, if they see a bullseye rash. And then finally, how do we treat Lyme disease? Well, it's actually quite straightforward. So you remove the tick, right? So a tick removal tool is very important. It's actually an essential part of any first aid kit. So you remove the whole tick. Then after that, you go and see your GP, who will, in most cases, issue you some antibiotics, and that will be that really. So it's really quite easy to manage Lyme disease and get on top of it. The tricky part is identifying it. Generally, there's a full recovery within a few months, so that's the positive side there, and it's as simple as that really. And finally, the most important thing is to be aware. So, especially in the month of May, it's Lyme Disease Awareness Month. So, take tick repellent. Take effective tick repellent on outdoor trips and a tick removal tool. Avoid long grass, so that's important. Stick to pathways where possible. Wear long sleeves and tuck your trousers into your socks. So that's pretty self-explanatory. So the ticks don't get up in there. Regular checks of humans and pets, right? So if you're going for a walk with your dog as well, keep an eye there. Speak to your vet about the tips and tricks regarding that. Wear light-colored clothing outdoor. This is important because it will make it easier to spot a tick and brush them off. So remember, ticks can be as small as poppy seeds. So careful checking is key. That's more important than the actual. I'd rather we prevent it than you get it and then go to your GP and get antibiotics and remove the tick. So pay special attention to the hairline behind the ears of young children. Talk to your vet. We mentioned that. Shower. Carry out thorough checks of kids, pets, yourself. And that's pretty much it. Don't avoid the outdoors just because you're scared of some ticks. Like and subscribe the video for more. We will see you in the next one.